Namaskar and welcome to the 15th episode of Health for All, a weekly show on health and wellness with special focus on current topics of concern brought to you by Heal Foundation. Our first session is Yoga for Heart Health. We have with us Ms. Dibya Prakash, an accredited dietitian and nutrition counselor, a wellness therapist, deep sleep mentor.
We will discuss about the importance of heart, factors that's affecting our heart health, and the practical solution, how to combat those problems.
वृक्षासन भी आपके लिए बहुत ही अच्छा है। ये आपके बॉडी में एक बैलेंस लाता है। आप जब इस आसन को करेंगे तो बैलेंस लाएगा, माइंड आपका काम होगा, क्योंकि स्ट्रेस एक बहुत ही बड़ा रीजन होता है आपके हार्ट इश्यूज के लिए। आपने देखा होगा तनाव, जब भी आपकी तनाव बढ़ जाती है, आपका ब्लड प्रेशर बढ़ जाता है, बहुत सारी चीजें इफेक्ट होती है। तो इस तरह से कामिंग इफेक्ट देता है, आपके चेस्ट को ओपन करता है, हार्ट को ओपनिंग का ये काम करता है। तड़ासना, वृक्षासना के लिए हमें क्या करना है? आपको अपने पैर पे सबसे पहले अपने आप को बैलेंस करना है और इसके लिए थोड़ी सी प्रैक्टिस लगेगी, कुछ दिनों की प्रैक्टिस लगेगी। सबसे पहले आप दाहिने पैर पे, राइट लेग पे खड़े होइए बैलेंस हो करके। लेफ्ट लेग को अपने उठाकर अपने थाइस पर आप इस बैलेंस कीजिए और अपने हाथों को उठाते हुए जोड़ करके काउंट कीजिए मन में। आप 2, 3, 4, 5। चेहरे पर अपने मुस्कान स्माइल बना के रखिए। फिर आप अपने पैर को नीचे कीजिए। फिर इसी तरह आप राइट लेग को उठाकर अपने लेफ्ट लेग के थाई पर रखिए और गहरी सांस लेते हुए हाथों को ऊपर ले जाइए। अपने आप को बैलेंस कीजिए। फिर आप अपने आप को नीचे कीजिए। आप इस काउंटिंग को बढ़ा सकते हैं अपने आप की जितनी जैसे जैसे प्रैक्टिस होगी आप इसे ज्यादा देर तक होल्ड कर सकते हैं।
We move on to the next session, which is Your Health Counter. Your Health Counter is a highly popular capsule. It is an initiative of Health for All to connect with India's top medical, nutrition, and wellness and public experts, policymakers to do a straight talk on the latest topics to get insight on disease prevention and health issues. In today's Your Health Counter, we have eminent Dr. Purushottam Lal, a pioneer in interventional cardiology. He has the unique distinction of introducing the largest number of procedures in the field of interventional cardiology for the first time in India, such as rotablator stenting, balloon, mitral valve valvuloplasty, heart hole closer, TAVI, etc. He has been listed many times in Limca Book of World Records. He has been named as the father of interventional cardiology in India by Professor Adnan Kastray from Germany, a reputed cardiologist in the world. He was awarded Padma Vibhushan and Dr. B.C. Roy National Award by the President of India, making him the most decorated cardiologist of the country. Welcome, Dr. Lal, but speaking to him is Dr. Swadeep Srivastava, the founder of Heal Foundation and Heal Health, and one of India's top health communication expert. He has been at the forefront of healthcare awareness through healthcare communication and has been instrumental in creating campaigns and platforms for healthcare improvements in India for the last 2 decades.
People in not only in Noida, in North India, but across the country and across the globe have seen a lot of pioneering work done by you, and the way you have been treating and working with your patients, particularly your motto of serving the middle and lower middle class in the country, is been phenomenal and such highly appreciated and decorated also by many awards and accolades which you have earned in your career of more than 3 decades, sir. Coming back from US, having a very, very successful practice in US, then coming back to India in Chennai, Apollo Hospital, then Apollo Hospital, Delhi, because you wanted to serve your country, progressed into becoming a chain of multi-specialty hospital, and Metro is today the name to reckon with particularly in the certain segment of the society which comprises of a majority of our population, and they need heart care the most. So you have also been instrumental in bringing that access of heart care to the people of India, sir. So what is the difference where patients should know in multiple artery diseases that angioplasty is good, or of course it's the call of the medical practitioner, but what patients should know about the benefit of bypass surgery over angioplasty and benefits of angioplasty over bypass surgeries?
A lot of people now they are quite aware of of the procedures. Those days are gone where the people didn't have knowledge. Now everybody checks with the internet and taking second opinion, third, which is always very good. But now my point is that we divide the treatment in four. If I see one angio where I feel that it is the best for the patient to have an angioplasty, now this is the angioplasty. And there is one group of patients which I would say the bypass is preferred. And then come the mixture. There we see the pros and cons, and fourth, of course, the medical treatment. Now, if I have a young patient and all the three arteries are blocked, and when I say young, say 40-year-old, 45, 50-year-old, I would prefer personally multiple vessel angioplasty. And if I have a patient at the age of 70, 68, I would prefer bypass, because that's the best time for the patient to tolerate the surgery rather than doing the angioplasty, and maybe sometime when they become 78, 80, the surgery becomes relatively difficult. So we go by each patient. And then at the same time, if I have patient coming from, say, my village or any village, where we find a patient will not be able to come for follow-up and so forth, and we want a very, very long-term result, bypass is always better for the long-term result. The people coming from the villages sometimes cannot afford, because these days the angioplasty, when we do the multiple vessels by using road ablators and so forth, becomes more expensive than the bypasses.
During COVID, especially the Delta phase, lung function was seriously compromised in severe infective cases. This affected oxygenation and in return functioning of the heart. Should patients who have recovered from COVID get a regular periodic heart evaluation test done? You can speak on patients with and without comorbidities who are down with COVID infection.
Recently, what we did was we conducted a study in patients who are COVID recovered. Now, those patients who are actually COVID recovered, these patients we started analyzing and seeing whether their heart is actually affected when they had a normal echo function. And to our surprise, what we saw was, this was documented in the Journal of Echocardiography very recently, that those patients who are apparently absolutely healthy with a normal ejection fraction, the subclinical dysfunction in the heart had already started occurring. Now, this is something which is revealing. What a person thinks that he's COVID recovered, this person is already having an effect on the heart when there's absolutely the equation normal. This we analyzed on the basis of speckle tracking and a special kind of imaging which is called strain rate imaging. And we are following up these patients. More severe was the COVID illness, the more chances was there that the heart would be affected. So definitely, while it is affecting the lung, it is also affecting the heart simultaneously depending on the severity of the COVID. So this is very pertinent that every COVID patient who is either recovered or is in the active phase of that particular disease must have a baseline cardiac checkup. It is mandatory. And this becomes even more important, especially when a patient is symptomatic. Interestingly, one good news is that those patients who are having an effect on the heart, the recovery that is happening on follow-up of these COVID patients is much better. So definitely heart or cardiologist's role is significant in any illness of COVID. And there are various pathophysiological mechanisms that are happening because of the direct damage, because of the indirect damage, because of the immune response that is being generated. But heart is definitely affected both in the acute illness as well as during the recovery phase, as well as in those patients who are apparently absolutely healthy. These patients still have some level of chances of having an effect on the heart.
At one hand, there is an excessive use of mobile and smartphone and digital space also affecting the health poorly. On the other hand, it has been detrimental to good health, in fact, you can say, particularly amongst the youth. On the other hand, we have got the digital technology and technology as a whole also complementing the efforts of doctors and hospitals. So what is your view on it? How digital can be best used for complementing all the efforts of the doctors and hospitals and helping our people live a better, more informed, healthy life?
So I would say that the theme is very clear. The theme is very clear for where lifestyle and habits actually play a role in all circumstances. The question which I think we should also ask is, are the habits always bad? In the terms of, yes, everybody knows drinking in excess is bad, smoking is bad for health, food is sometimes bad, certain types of food is bad. But I think in India, what we are forgetting is that education awareness is missing. So our individuals, where technology can play a role, in our sense, and that's why the India Health Link, we started with a simple mission. Can we educate our people to be able to understand what is bad, what is good? And more importantly, in healthcare, there is no one size fits all. The correlation of these factors, let's say we can say exercise is very good. Somebody can exercise every day, all day, but again, they might not be eating good food. Maybe they have other factors. Maybe they're not even fit for exercising all day, every day, because they're not supposed to. Now, how do we correlate these factors with somebody's health is where the technology can play a role. And technology can play a role by educating people and making them aware of their own self. That mobile sometimes is wrong because everybody relates that to a social media use of mobile all the time and the screen usage. But at the same time now, because of telemedicine, because of the phone in most of the people's hand, they have access to those experts, that information that they can gain themselves. The only, again, where we are coming into picture is how can we bring them in a simple, accessible way that everybody can understand that. We are not bringing new information to individuals, but technology can play a role in that particular area, that the guidance of people to correlate what is right at the right time, at the right place. It's basically India, like the rest of the world, the non-communicable disease burden is very high. And what we believe, the most can be prevented by access to basic healthcare, education and vital information. So if nothing, what we are singularly trying to manage here through IHL Care program is we are trying to empower people with this information, with their health information, before it is too late. 3 pillars of our program, what we call IHL Care, what the 3 pillars of our program is, it's human-centered. So we build the system around people, and what we are giving them a first-time access to what we call health account. But more importantly, what's missing in India right now is that the accessibility to capture that 95% of vitals, which are crucial to your health in the ease of your own comfort. Whether you are working in a company, you go to a cafeteria, whether you are living in a housing society, you should just go to a wellness community hall, or you are in a gram panchayat in a village, you can go to a nearby pharmacy, or wherever you are. You should be able to screen these vitals at ease and without any intervention, without any paramedic assistance. That is where we are bringing this scalable HPOD, which is one of a kind, clinically validated system, which within 3 to 5 minutes, without any assistance, can screen blood pressure, 6-lead ECG. It can do temperature, oxygen saturation, full body composition, height, weight, as well as the BMI, just a general calculation. And all that is done it's language compatible, and it's all accessible system. HPOD, which we're bringing, it's a small ATM size machine. Anybody can put it wherever they want. The entire platform is cloud managed. It's the HIPAA certified, which means the data which we are capturing, it belongs to the user, and it is secured and private from our technology itself.
People who were COVID infected were told not to exert for a period ranging from 3 to 6 months due to the involvement of the lungs and the heart. There were instances of young people unexpectedly dropping dead. You have an armed forces background. How is this issue tackled in the armed forces where physical training is sometimes rigorous?
First of all, we must understand that COVID-19 illness, just like any other viral illness, it affects all organs. Some are involved more, which express themselves clinically. So you get diagnosed with COVID pneumonia or COVID myocarditis or COVID thromboembolism. But it's a systemic illness. There could be a low-grade myocarditis resulting in subclinical myocardial dysfunction picked up by specialized tests like echocardiogram. These are the patients who are at risk of exercise-induced, or when they go beyond their effort tolerance, to develop arrhythmias, which they are vulnerable in any case. So a good marker for that is that if somebody recovers from COVID-19 or any other viral illness and suffers from profound fatigue, the definition of fatigue is feeling of being tired after minimal exertion for which person is used to otherwise. So these are the patients where one should suspect there could be a subclinical myocarditis, which makes them vulnerable to all kinds of problems, including sudden death on exertion. So these are the patients who should be investigated in a targeted manner. And if there are signs and symptoms of myocarditis, they should be given prolonged rest. And there are some medicines also, which I will not go into detail here, but they can be put on some medicines also to make them recover, particularly those who are found to have impaired heart function. Those patients who have profound fatigue or sequelae after initial illness should be investigated. All others can follow routine healthful activities like good nutrition, remaining well hydrated, etc.
Do you see the linkage of these over medication with the increasing incidence of heart disease?
Over medication related to COVID and heart disease? No. If anything, we give anticoagulants to most of our patients who have COVID, and that, if anything, can protect to some extent against heart disease. So I don't think, other than steroid, of course, steroid has so many side effects, including cardiac, which if you start a patient on steroids, then you have to monitor his blood pressure, his sugar, and by default his heart. All my patients who have, I'm a surgeon, who have had heart surgery, they are always worried should they have vaccines. Now it is imperative that a heart patient, whether operated or not, whether stented or not, should get a vaccine as per our current knowledge. So my message to your viewers, who I believe are quite, most of them are not doctors, is that yes, you must get your vaccine. Antiplatelet does not matter. Aspirin does not matter. But if you have had a heart valve surgery and you are on a blood thinner like acetylene, then you must monitor your INR, which all heart patients who've had valve surgery know. And if it is below 2.5, then you can get your vaccine without any problem. If it is more than 2.5, then better to avoid.
What are the precautions that COVID recovered people should take before hitting the gym?
What kind of precautions they should take is the first and foremost thing that I would advise them is to take approval from their cardiologist or from their doctor. In case first they have to check their blood pressure, sugar, all the other parameters should be under check before they hit the gym. Secondly, if you are hitting a gym, it is very, very important that you're guided by a qualified nutritionist and a fitness trainer. As I said, most of the time, these trainers or dietitians, if they are, especially the trainers, if they are not qualified enough, and if they are giving, a lot of time it is seen that they have been giving a lot of diet advice to their patients or to their clients, which should be avoided. And once you have recovered, it is important that you get your heart rate checked, your blood pressure checked, and your diet should be a properly disciplined diet. Once you feel there is no fatigue, you're not getting tired, only then you should think of going back to the gym. Otherwise, I would advocate start with a very, very slow paced exercises.
Should young COVID recovered IT professionals take a periodic heart evaluation test, especially TMT? And if so, how often?
Anybody who has recovered from COVID, you need to look at the heart, because it's very rightly said that we are seeing a lot of upsurge of cardiac illness, especially in those who have been recovered from this virus. And the more severe the disease, especially those who have been through an inflammatory phase of COVID-19, the chances of having an underlying cardiac issue is also there. Whether it's a thrombotic issue, or whether it's a myocarditis, or whether it was just they developed myocarditis during the COVID period, or they developed it post-COVID sequelae, or the long COVID, yes, you need to look at the heart. So whether you're an IT professional or not, whether you're young or old, if you've had COVID, I think you should go for a cardiac evaluation. The decision of whether to go for a treadmill or not is again not one size fits all. I would really not recommend anyone, young or old, to take the decision of doing a stress test on your own. Meet your doctor, let him assess you, let him look at your functional capacity, and then take a decision whether you need to go for a stress test or not.